Hey, moms and dads, it's Dr. Scott back here with this next critical component to having the maximum success during your care plan. And it is literally talking about your care plan. So, moms and dads, here's a few basic things that I want you to understand. The care plan is carefully designed as a process to calm your brain and giving it the time to reconnect and to heal. Regardless of if you're coming in because of a child with ADHD issues or autism or immune challenges, or if you hurt. All of these things, they live in the brain, and the brain did not get here overnight, and it does not change overnight. So understanding this process will help you to really understand what it takes to get the maximum out of your care plan. So let's talk about all of the important aspects. First and foremost, there are two very important things you need to understand about phases of care. So a lot of our patients come in through what is called restoration care. Restoration care is more specifically a part of the care plan that is geared towards fixing a problem. Whether it's you have a child who has symptoms of ADHD, a child that's constipated, a child with autism, who you're trying to improve the symptoms and quality of life, or if you have back pain or headaches. This whole phase's goal is to get the symptoms to the best place possible so that we can set you up to transition to what is called wellness care. Now, wellness care, moms and dads, is where we have a different mindset altogether. Wellness care is literally geared towards making sure that you or your family members achieve the highest state of health possible. What you will understand as you progress through care is that although you may be new to chiropractic as a lifestyle is a very different mindset or perspective on healing. It's proactive health. And so wellness care for us is once we've achieved the best, most awesome quality state of life, then we want to maintain it. And so if you have a child or you yourself is coming in for restoration care, the goal is to get your quality of life to the best state possible and then maintain that through wellness care. Now, not every patient in our practice comes in through restoration care. We have a number of patients, many of our family members that come in, and they only come in specifically for wellness care. They see the tremendous results that their loved one, their child has seen from getting care, and they say they want that for themselves. And so if you have questions about wellness care, ask one of the doctors here on staff, but understand that wellness care is the goal of everything. It's about making sure that we as community members, we as family members, we as moms, dads, parents, that everyone in our family is living the best quality of life possible. So wellness care for us is the ultimate goal for each and every one of you. There's a couple of basic rules that I want you to understand when it comes to the care plan process. Healing is a process, and there's two rules that we just can't violate. There is no process that doesn't require time. And when we talk about this, as the care plans are laid out to you during the report of findings, what we are taking into consideration is that the need for time that it's going to take to get the maximum results possible, and the amount of consistency, frequency of visits, what is going to be necessary to make sure that your child's brain or your brain is going to have the input necessary to refire and rewire so that we can stabilize things. Because these things, these processes that we go through to get to a point where quality of life is not where it should be, they oftentimes don't happen instantly. In the vast majority of cases, they are things that have been brewing in many cases for years. And they've been slowly wearing down our quality of life. So as we move through the care plan process, it's really important that we keep in our mindset that it's going to take time to get better because we didn't get here overnight. And the more consistent we can be with our care plan, our scheduled visits, doing the right things here at the office and at home, the better the overall results that you are going to achieve. Now, a couple of guidelines here for the care plan for you. So what I want you to understand is that the care plan is designed so we have monitoring steps. So one big important step is that every 12 visits, a new scan will be performed. The reason for this is we want to make sure that we are monitoring the change in the nervous system to make sure that it's on track with our expectations. We will also have periodic goal reviews, and the doctors will review with you at the report of findings the frequency necessary for the goal reviews. And so as you go through the process, you'll have very specific checkpoints. Now, each progress scan is going to have very specific things that you're going to get as a follow-up to this. The progress scans, once they're performed, you're going to get a new scan with comparisons from the last scan set included. So, for example, When you have your initial scans, we call those our baseline scans, those are considered to be scan 0. 1 month into care, give or take, you're going to get a new scan performed. And with that, you'll get the new scans and you'll get a comparison scan page that'll help you to see how things have changed on the scans from the first scan to the current scan. In addition to that, we're going to provide you with what's called a scan report. And what this allows us to do is to track progress towards the scan goals. And we keep it very simple. It'll be all of the same areas that you see on the scans, but what it'll do is it'll keep it in very basic terminology so you know, are we on track? And so what it'll say is, number 1, needs improvement, or number 2, making progress, or number 3, looks good. So if we see needs improvement, it means that it's still not where we need it to be, or maybe something's gone backwards. Making progress means that things are on track towards hitting our goals. Making progress in the right direction. Looks good means that we are within normal limits or we have achieved our goal. This is a really important thing because, you know, our goal is to get all aspects of the scan report so that it is within that area of looks good. Okay. Now, in addition to this, when we talk about the goal reviews will be set up so that periodically, every 24 or so visits, we will go through and review the specific goals, the subjective goals that we set forth. And so we're going to use both the objective data from the scan reports and the scans coupled with the subjective data to make sure that we are hitting the goals, both the goals that you set for your child with the doctors and the goals that we set during the report of findings to make sure that things are on track to stabilize and get the maximum results from care. Now, a couple of key things that you want to keep in mind as it relates to your appointments. Number 1, frequency matters. If for some reason you have to miss an appointment, whether it's illness, work, child schedule, your schedule, we need to make sure that we make up that visit ASAP so that we can stay on track. Because if we start to lose momentum, we start missing visits, then we can quickly lose progress towards the goals that we've been working towards. Keep in mind, each adjustment is very much like a Ferrari on the highway. One thing I want you to think about is that, you know, when you're going down this pathway, there's a lot of momentum, right? That's why I like the Ferrari analogy. The brain is moving really fast down one path. And so for us to make the changes that you desire, we have to put enough input in over enough time with enough frequency to slow things down, to get the brain to start to rewire, but more importantly, so we can change directions and turn the wheel, right? Because it's going to take time for us to go and get to a point where the brain is in a state of constant change. Because right now, let's say, for example, you have a child that has ADHD. Your child's probably been dealing with these symptoms, this process, since maybe even before birth, but most likely from very, very early on in life. And so to change the way that their brain works, it's going to take a lot of time and a lot of frequency and a lot of momentum for us to be able to make the changes so their brain starts to function in balance. Remember we talked during the video, right? That dyskinesia leads to the disafferentation, which leads to the dysautonomia, which leads to the dyskinesis, which leads to then the disconnection. Well, to go backwards through that process, we need to make sure that our intervals in the beginning are very small so that we can tap the brakes, tap the brakes, tap the brakes, and unwind that whole process so that your child's brain or your brain can start to work the way that it is supposed to. But there is definitely a process to this that we have to abide by. So moms and dads, I hope that this was helpful. I hope that you understand that there is a critical component to being super consistent with your care plan. Hopefully you understand all of the management steps that we're going to employ. And hopefully you understand the importance of the frequency of the care plan that was laid out when you met with the doctors originally. All right. I will look forward to seeing you on the next video. God bless you guys. Have a great day.